Okay, I have also shown you place of service. Here codes are categorized as it is an outpatient and established one. So the code range would be 99211 till 99215. So let's go to CPT manual, and here it is 211. So do we have history and exam and MDM in it? No. In this, and here, if you remember, at least two required out of three key components. So we have only two key components mentioned in the question, that is exam and MDM. So it is sufficient for us to find the code. So is it problem focused history? No, we haven't got any detail of history. So we have to take only MDM and examination. So a problem focused examination? No, it was detailed examination. So not this. Expanded problem focused exam? No. Okay, so a detailed examination. It is also at least two out of three key components. So we have detailed examination, and MDM is moderate complexity as mentioned in the question. Let's go back to that question here. Okay, here is the question. So here we have detailed exam and moderate complexity MDM. That's it. And it's an established patient. So what would be the answer here? So 2 out of 3. So the answer is 99214. Okay. So let's go for the next slide here. Critical care services. So the critical care services include services like chest x-ray, gastric intubation, ventilator management, vascular access procedure, cardiac outpatient. OP is a short form of outpatient management. Okay, it is evaluated by time. Okay, do you remember the contributing components? Yes, it is one of them, time. So it is evaluated by time. Its code range is 99291 and 99292. There are only two codes, but 99292 comes, like in multiple times. So just go through it. It is 99291 between 30 minutes and 74 minutes. If the patient, oh, I'm sorry, if the physician spending time with the patient between 30 to 74 minutes, then we can code 99291. If the physician spending time more than 74, that is 75 minutes, and in between 104 minutes, so we will code 99292. And after 104 minutes as well, he spends time. So after that also, after every 30 minutes, we need to code 99292 with 99291. Okay, we cannot just simply code 99292. Okay, we have to code first 99291, then only we can code as 99292. Okay, got it. If it is more than 104 minutes, if it is like 2-3 minutes, then we cannot code again 99292, because after every 30 minutes we need to code. So we have to wait for the 30 minutes. That's the point here. Okay, so let's go, because if it is less than 30 minutes, if the physician has spent time with the patient less than 30 minutes, so we will not quote this critical care services. Okay, let's go for this example here. So physicians spend critical care time of 46 minutes on patient, that is more than 30 minutes. So what is the appropriate code? So I assume that you can guess it, because after every 30 minutes we need to code. So we have to wait for the 30 minutes. That's the point here. Okay, so let's go, because if it is less than 30 minutes, if the physician has spent time with the patient less than 30 minutes, so we will not quote this critical care services. Okay, let's go for this example here. So physicians spend critical care time of 46 minutes on patient, that is more than 30 minutes. So what is the appropriate code? So I assume that you can guess it. Let's find out here. Critical care. Okay, here are the critical care services. You can go through the description as well in your CPT manual. Okay, here also there's a table. You can see it. If it is less than 30 minutes, then appropriate code must be any E&M code, but not the critical code. Okay, not these two codes. If it is more than 30 minutes but less than 75 minutes, that is 74 minutes till 74 minutes, so you can code 99291. And if it is more than 74, that is 75 till 104 minutes, then you can code the base code, that is 99291, and the add-on code you can say 99292. Okay, got it? So for the question it is 46 minutes, so it comes under this bracket, so it would be 99291. Okay, let's move on to the next slide then. Emergency department, an ED, you can just go for the short form as well. An ED is defined as an organized hospital-based facility for the provisions of unscheduled episode services to patients who present for immediate medical attention. Whenever a patient comes to the emergency, we should not ask if it is established or new patient. We should not, we should have all the facilities in the hospital while attending that particular patient of emergency. So it is obviously not scheduled patient, it is unscheduled. So the facility must be available 24 hours, at any time the emergency can be happen. So all the services should be available in the hospital for 24 hours a day. Its code range is 99281, 99285. Okay, so these 5 codes: 281, 282, 283, 284, 285. Let's see, go ahead. So with the guidelines, you should always remember these guidelines. Okay, so no need to check new or established, as I told you earlier. Status of a patient, consider as new. Just consider it is a new patient and go for it. If critical care services performed in emergency room, do you remember the previous topic, critical care services? Yes, the time. So code only the critical care services. No need to code any other emergency room codes. Okay. If observation services performed in emergency room, code only observation services. Okay. Observation services fall under when the patient hospitalized more than one day. It's do you know what is the difference between inpatient and outpatient, hospital and office? So inpatient or outpatient means, yeah, like the patient, if a patient is rendering the services, rendering its services more than, if the patient stays more than 24 hours, means one day 24 hours, so it is an inpatient. If the patient stays in the hospital less than 24 hours, so it's an outpatient. Got it? So observation is after treatment. For certain medical drugs, if the physician has given certain drugs to a patient and need to observe, like uh, what are the consequences, chances, like the patients must have. So check for checkup or determine any of the diagnosis that patient needs. So for that particular reason, you have to wait and see and observe the patient. So these are observation services. Patient come to hospital for ED, then they admitted as inpatient hospital, then code only admitted code. Okay. So if you come to know that it's an emergency and patient needs to stay more than 24 hours, so you have to admit it. So it would be inpatient services, and you have to code admitted code only at that particular time, not emergency. Okay, yeah. Next. Yes, we can go for the example as well. A patient came to emergency room. Physician documented detailed history, comprehensive exam, and medical decision making. As the patient comes in, the physician attend the patient and just documented that the detailed history and comprehensive exam and medical decision making of moderate complexity. So let's go for the codes. Okay, here it is the 99281 emergency department services. Okay, visits. So in 99281 we have problem focused history, problem focused examination, and straightforward medical MDM, you can say. So what we have in the question here, we have detailed history, comprehensive exam, and moderate complexity. Let's say detailed history. Okay, not here. Yes, detailed history. Second is comprehensive exam. Is it 2 out of 3? No, we need to go for all three components. 3 out of 3. Here we have moderate complexity as well and detailed history, but not comprehensive exam. For this, I'll just explain you what we have to do, because it is not matching for the question. So at this particular time, how to determine the level of service here. So if we have, like I've just written in very short initial alphabet, like P as in problem focused, E as in extend problem focused, D as in detail, C as in comprehensive. Okay, so this is, here we have history, exam, MDM. So we have here detailed history. Okay, so not E, I would say here D. Okay, and okay, D, and here we have comprehensive examination. and moderate complexity. Okay, but if we go for these three, okay, so not for comprehensive exam, that means that we are fulfilling all this. Whichever is less, remember that whichever is less, we have to go for this. If there is only, you can say, physical exam and history, we have so we have to compromise this exam as detailed exam, okay, because we have detailed history and moderate complexity MDM. So we have to compromise exam as well. We don't have to be unable to go for the comprehensive exam because we don't have comprehensive history and high complexity. So we have to go for moderate complexity and detailed history and detailed examination. Okay, understood? For example, I'll take one more here. For example, we only have here we have detailed history and problem focused examination and not straightforward but low complexity. Okay, in the question it is written as low complexity MDM, problem focused examination, and detailed history. All three are different, so we have to take the least. So in that we have to cover all these three. So which one we have that comes under all three? Exam, history, MDM. Yes, exactly, is problem focused. So for this we have to go for the code which have all these three. Okay, understood? Hope so. So for now we have detailed history, not comprehensive exam. We will take detailed exam and moderate complexity. We have detailed history and moderate complexity and comprehensive exam, but we cannot go for the comprehensive exam. That's why we will take only detailed history, detailed examination, and moderate complexity MDM. So the code would be 99284. Okay, all right, let's go ahead. Okay, this is the last topic we have for the session. It is preventive medicine. So it is also very simple like other codes. Its code range is 99381 till 99397. So we will use 95 modifier if we are having any telemedicines. Medicine can be provided prescribed through telephonic. So if if they mentioned any telemedicine in the question, so we have to use 95 modifier. Okay, and the tips. So initially we have to check if it is a new or established patient and patient age and initial or observation care. If it is a inpatient hospitalized patient, so we have to check if it is initial or observation, because at that particular time then only we can give them medicine particularly. Okay, age. Why age? Because sometimes for some medicines the age is a big issue, so we have to check the age as well. Okay, so all right then, thank you very much for your time and have a great day.